This is Dr. Alan Nazari, and I'm joined today with Dr. Sunisa, one of the premier dentists from Bangkok MALO CLINIC in Thailand. Dr. Sunisa is a graduate of Chulalongkorn and Mahidol University, as well as has completed postgraduate training both at New York University as well as University of Southern California. Dr. Sunisa, welcome to the show.
Thank you for having me today.
It's a pleasure. You're such a busy dentist. My question to you is, why are you so popular? Every time I walk to the clinic, all of the patients are always asking about Dr. Sunisa. What makes you so popular?
Thank you for saying that. I just treat everyone like my family.
It must be something because people just love you.
I just understand them and try to do the best treatments for them.
Yeah, but I'm sure you're also a very, very good clinician, an excellent practitioner, and so forth. You know, I know some of our audience, they may not know what does a prosthodontist do. Can you explain what a prosthodontist does? What makes a prosthodontist different than like a regular dentist?
Most of the prosthodontist job is we take care of crowns, bridge, prostheses, all prostheses, including dental implants. Most of the cases that we take care are complex cases.
Complex cases.
That's
so,
right.
so there may be some dentists that they do simple cases, but prosthodontists, they do more complex cases. The complex cases, I assume, would be like what?
Like the case that need many treatments at the same time. So we have to make a good plans for them. So like we have to do adult examinations and know what their expectation is and
Okay.
try to set all treatment for them.
So patients come to you because maybe they need like several root canals, several broken teeth.
That's
So
right.
you need to put like a comprehensive treatment plan together for them.
That's right. And it's very good that our company or our clinic, we have all specialists stay together in this clinic. So the patients don't need to go to any other places to finish their work or to get their work done.
You mean all the work is done under one roof,
That's
basically?
right, because
Okay.
we've got all specialists here.
Yeah, I know a lot of patients, they don't like to be referred from one clinic to another and,
That's
you know, get into a taxi or in a car to go someplace. So that must be very convenient for them.
That's right.
Well, what is it about the Malo Clinic? I know now it's called Bangkok Malo Clinic. What is a Malo Clinic?
So MALO CLINIC is the largest dental center in the world, located in many countries, like over than 50 cities,
Wow.
5 continents, and most of all, the MALO Clinic has become famous because they are the first or the original developer of immediate loading dental implants.
Okay, so when you say immediate loading, means what? It means they place the implant in,
Yes.
okay, and
Is-
then what happens?
So it means that the patients can leave the clinic with the new teeth.
Okay,
That
so it's an immediate placement of an implant, and then they put a tooth on top
That's
of the
right.
implant right away.
Over the implants right away after the surgeon put the implants in.
I see.
The
Okay.
patient have teeth and go back home.
Okay, and how many teeth can patients have in one session?
How many teeth? What does it mean?
Like how many can they have? Like a full jaw of implants in one session with full teeth?
That's right. Like the patient who have no teeth, or the patient who the teeth
Or like
they will lost the
missing,
teeth
yeah.
there, or the patient who wear the dentures. So they can have just 4 implants, and they can have the bridge on top of it within 24 hours.
Oh wow! So
That is all in full.
right. Is the all-on-4 procedure something part of the Malo Clinic? Was it developed at the Malo Clinic?
Yes, because the MALO clinic, Dr. Malo, he's the one who proved that you can have good or special for dental implants with their strategic positions
Okay.
and you can load it straight away with the teeth on top of it within 24 hours, and it works well.
Is that a popular procedure?
It's very popular procedure for nowadays.
Okay. And why do you think it's popular for patients to have an all-on-4?
Because it works, and it does prove that it's good enough and lasts long. So, but not every cases or every clinic can do the same thing, because even though they got all-on-4, but it might difference.
I see. So because I do see lots of advertisements that they say, all-on-4 and so forth. And honestly, I've seen some patients that, some dentists, they do some mini implants that they call them all-on-4. So I assume you follow a certain protocol for Malo, is that correct?
That's right, because we become partnership to the MALO clinic, and all of our specialists went to MALO clinic in the head office, Lisbon, to train there.
So they have been trained. It's not like
That's right.
It's not like they just went for a weekend seminar. They actually have gone and they've done hands-on surgeries and so forth before that. Very good. So what is it about the all-on-4 that is a kind of like a benefit to a patient? Do they save money or I know you're saying they get their teeth in one day. That's
right.
a great benefit. But what else do you think is a benefit?
It's not just about the cost. The patient don't need to do lots of bone grafting, laser trauma, and the patient don't need to wait long time.
So are you saying that actually patients can avoid bone grafting with this procedure?
Yes, most of the case.
Most of the cases.
Right.
So if a patient has been told by other dentists like they have to do some bone grafting in their sinus, you're saying most of these cases we can avoid having bone graft. Is that correct? Wow.
That's right.
Okay. So it's not just about the financial cost, I guess.
That's
it
right.
could be a emotional cost as well that patients are avoiding.
That's right, and it's like life changing. So most of the kids who come here, they usually have very bad teeth or not very nice looking teeth, and they come in and they leave the clinic with wonderful, beautiful, and gorgeous sets of teeth.
Can they eat with those teeth right away?
That's right, they can eat with those teeth, but yes, at the first few months, the patient need to have soft diet until the implants completely integrate to the bone, so they can use like normal.
Okay, so once the implants are completed,
Yes.
or have healed completely with the bone, then they can eat much harder food and
That's
so
right.
forth. Okay,
That's
okay.
right.
This sounds like a revolutionary type of a dental treatment.
That's right. It's truly changing their life.
Right. So what do patients have to do in order to find out if they're a good candidate?
So we need to do adult examinations. We have to make sure that the patient need to pull their teeth, and also the patient would like to pull their teeth too. And then that is the first thing. So after that, we have to do more evaluations like X-ray or the photograph. So many
Like sides
angle. That's right, of the patient to record, and we have to do a 3D X-ray. It's a cone beam X-ray.
Okay, what is a 3D X-ray?
It's the X-ray that you can see every dimensions of the bone. So you make sure that you can put implants at the right positions, and you can predict the result after that.
Right. So you basically can see the height of the bone, the width of the bone before the surgeon actually starts cutting the patient,
That's
so they can understand
You're
that.
right. You're
Okay,
right, yes.
very good. So I just want to make sure our audience understands it. So the all-on-4 is a fixed prosthesis. So basically, it does not need to be removed. It cannot be removed by a patient. It only can be removed by a professionally competent dentist. Is that correct?
That's correct.
Very good. So, what about the maintenance of all-on-4? Do they have to be maintained? How patients maintain the teeth?
Yes, they need special device like water pick or water jet, they have to clean it very well underneath that because it's a fixed bridge on the implants, right? The patient cannot take it out by themselves, so they need to clean properly. So that we will recommend them or teach them or choose the device for them to clean. And every couple months or at least once a year, the patient needs to see their specialist to take it out for cleans and check everything.
Is this an expensive procedure?
That is not expensive or inexpensive at all for take care of it, for maintenance rates.
Dr. Sunisa, it was wonderful to have you on the show. I would like to invite you to come back and discuss other dental procedure with our audience. Any final message for patients who are considering, let's say, an all-on-4 dental procedure?
Okay, so if you got problem with your teeth, you would like to come to Thailand to find a good treatments, please consider to visit at Bangkok's MALO Clinic. We have branches in Bangkok and Phuket. We all welcome all of you to come.
Thank you very much.
Thank you. Thank you.